We turn now to former President Joe Biden and the outpouring of support after learning he's been diagnosed with an aggressive form of prostate cancer that has now spread to his bones. Mr. Biden's personal office says he was diagnosed on Friday after increasing urinary symptoms. The former president is 82 years old. A source familiar with the Bidens' thinking tells NBC News they're meeting with doctors and considering multiple treatment options, including hormone treatment. Now, for more context on this developing story, we're joined by Dr. Jonathan Wong. He serves as a professor and chair of urology at MedStar Washington Hospital Center.
He was also my surgeon earlier this year. Dr. Wong, good to see you again. Thank you for your time this morning. You're not treating the former president, obviously, though this is your field of expertise. When you hear that he's been diagnosed with an aggressive form of prostate cancer, what strikes you about that? What are your concerns? And I guess what I'm getting at here is it odd that his cancer has progressed so much at the time of diagnosis?
Yes, no, thank you for having me, Tony and Jumi. Clearly, whenever we see high Gleason score of prostate cancer, we know that that is a lethal form of prostate cancer. The fact that it has already spread to the bones, consistent with stage 4 prostate cancer, is quite concerning. Fortunately, based on that report that it is hormone sensitive, which means that it's a very much manageable, it's not a curable condition, but certainly manageable condition where hormone suppression can keep the cancer in remission for possibly for a very long time. The speed at which this kind of cancer can grow can really vary from a person to person, but the fact that this is a highly aggressive form of prostate cancer, it can progress very quickly within 12 months. But exact timing of when it occurred and how fast it actually progressed, it's hard to determine, without knowing his medical records previously.
Dr. Wong, the former president's cancer, as we've heard in the reporting, has, spread into the bone. Is that common with prostate cancer?
In general, no. But this particular grade of cancer, yes, it's very common to develop early bony metastases. I've certainly seen patients within 12 to 18 months present with metastatic cancer when the Gleason score, which represents the potential aggressive behavior of this cancer, is very high. So, it is unusual for someone to be diagnosed with such high-grade cancer, but when this type of cancer forms, it can definitely progress very quickly.
Apparently, the former president is considering that hormone treatment. What is that? How does that work?
So prostate cancer is mainly driven by testosterone. So simply suppressing and modulating our testosterone level with medications, you can actually cause cancer to regress significantly. There's also radiopharmaceutical that's now available that can target specific bone lesions. In some cases, radiation may be needed for local control. And if President Biden had significant urinary issues despite receiving hormonal suppression, sometimes laser surgery to alleviate urinary outlet obstruction may be needed.
Yeah, doctor, just a quick question here. Oftentimes when we hear the word cancer, our mind automatically goes to chemotherapy. Is that not an option in this case?
Chemotherapy is kind of the last resort when prostate cancer becomes hormone insensitive. In those cases where cancer is deemed to be hormone sensitive, androgen deprivation therapy is the mainstay treatment. If that fails, if someone does progress to hormone-resistant prostate cancer, then chemotherapy will be needed in that setting.
Obviously, the former president is 82 years old. Sometimes we hear that when older men are diagnosed with prostate cancer, it might not even be treated. President Biden's cancer obviously is very serious. Does his age complicate matters in his treatment?
It does come into play, Tony, that certainly some treatments can cause a lot of side effects. But having said that, because of the type of cancer that's found, the potential aggressiveness, the fact that it's already spread to the bones, I do believe that President Biden will likely need full course to at least cancer under control first, after which they can consider maybe holding back certain treatment and monitor him thereafter. But I think initially the fact that it has already gone to the bones, I think they will need to start systemic treatment, mainly using androgen deprivation therapy. And then once cancer is deemed to be in good remission state, then consider maybe holding systemic treatment depending on his side effects that he may develop.
Your message to men, all things considered, obviously this diagnosis, it seems, came late. We don't know the details of his previous care, but your message to men.
For me, as men are living much longer and a healthier lifestyle with a very long life expectancy, I do think that men do need to discuss with their urologists, primary care physicians about pros and cons of prostate cancer screening and make that individual choice. In men in good health, life expectancy greater than 10 plus years, I do see a benefit of annual screening using PSA and digital exam.
Yeah.
All right, Dr. Jonathan Wong, thank you very much for joining us this morning with your insight. We really do appreciate it, and it's good to see you again.
Thank you.
We'll be right back.